Hello and welcome. This is Dr. Bhatti, and today we are going to discuss, on the request of a subscriber of mine, what are hair transplant fibers? Synthetic hair transplant, also called as artificial hair transplant. Is there a place for artificial hair transplants in hair restoration surgery? So that is the topic for the day. And if you're interested in this topic, stay on. So in the days of instant coffee, instant food, somebody thought, why not have instant hair? Reduce the downtime of growth of hair and have lush hair on your head if you're getting married. Instant hair restoration is what is promised by synthetic hair transplants, also called as artificial hair transplants. To understand artificial hair transplants, we must differentiate between implants and transplants. Well, in natural hair transplants, it is the hair from the back of the head, your own hair, which is a living biological tissue, which is moved and relocated to the bald area. It carries with it the same characteristics that are peculiar to the area from where it has been lifted. The characteristics are, it is permanent, it is already genetically encoded when it will thin, how much curl it has, how much wave it possesses, and when is the time when it will start to gray as one ages. After the growth period of about 6 to 9 months, no special care is needed for transplanted hair. It is your natural hair. It will continue to grow. You continue to visit your barber just like before. Many times the barber can't tell that you got a hair transplant done, and there is no specific instruction to cut the transplanted hair in a specific manner or to take some special care for transplanted hair. It is your own hair which has just merely been relocated. It continues to grow. As you age, it will continue to gray, which will match the other areas of your graying head. So there is no special care required for a natural hair transplant. However, synthetic hair transplants or artificial hair implants are implantation of synthetic material referred to as implants. Therefore, we do not use the term transplant in these cases. When we use an implant, a synthetic implant, the process is called implantation and not transplantation. So it is synthetic or artificial hair implantation and not synthetic or artificial hair transplantation. So that is a very subtle difference between the two. But when you get confused between these two terms, there are thousands of questions which arise in your mind. Implants used for hair restoration are made of synthetic fibers, MODACRYLIC, POLYACRYLIC, polyester. These were not exactly biocompatible. The body rejected it in a very short span of time. Over a period of years, due to this problem, the companies have refined their synthetic implants and now come out with polyamide variants. These are more biocompatible, but not completely biocompatible because they still are foreign bodies and the body continues to strive to reject them. Polybutylene terephthalate or PBT is the composition of the latest hair fiber which is commonly in use. However, the use of implants in hair restoration has a long, checkered, and at times inglorious past, ever since they were first used in 1970. Since there were too many complaints to the drug authorities on forums, in quotes, against their use because they were causing so much of inflammation, cyst formation, dense scar formation, and the fear of carcinogenicity, that is cancer formation, was not going away. So in 1983, succumbing to public pressure and pressure of people in the medical field, the US FDA, which is the drug controlling authority of the United States of America, banned its use in 1983. It stated in its order, in its ban, that the information provided by the company was inadequate, was deceptive. There was also the term fraud used to refer to the marketing of the artificial implant, and therefore it was banned in the United States of America in 1983. However, it was not so in other countries. In countries like Japan, East Asian countries, it continued to be a legal entity. There was no ban on artificial hair implants in many countries the world over. Recently, this company has been trying to re-establish its credibility by reinventing and renegotiating the use of synthetic hair implants. There have been numerous pleas and petitions to the US FDA, but they've fallen on deaf ears. So this status quo is maintained till today, till this talk. A little bit about the hair fibers. The hair fibers are synthetic materials which are available in 4 physical forms: curly, wavy, afro, and straight. And there are 13 different colors and shades available for use. It has a knot or a bend at one end which holds it under the skin surface. And many of the new varieties have a curve just as it exits the skin surface, so that the hair can be fashioned or groomed or combed in a particular fashion, which was not possible earlier because they used to be all straight. To set the hair down was quite an effort. So before a hair implantation process is done using these fibers, what is mandatory is a test session entails about 100 to 500 grafts being used, and the surgeon or the physician, whoever is implanting the grafts, puts the patient under observation for about 4 to 6 weeks, where it is noted how the body responds to this foreign body, whether the inflammation is so intense that the body is immediately trying to expel the tissue, that is a hastened rejection response, or if the body is retaining the hair fiber. Well, the hair fiber is a foreign body. It is destined to be rejected by the body in 2 to 3 years. However, if it is rejected within 4 to 6 weeks, this procedure is not done because the patient will be far from happy with the procedure. So during this process, the patient is placed on regular antibiotics for about 7 to 10 days, and after 4 to 6 weeks, the decision is arrived at whether to continue with the session of hair implants or to reject the patient. So if the patient has passed this test, from 1000 to 6000 implants can be done in one session. The fibers are placed in the deep gallial layer of the scalp using an implanter pen. The anesthesia process is the same as hair transplant. The only difference is that the harvesting is not to be done, but the planting process is almost the same as far as use of anesthesia and implanter pen is concerned. The depth of plantation of a hair in hair transplant, unlike an hair implant, is a mere 4 millimeters average, whereas in a hair implant, because it is put deep into the gallia layer of the scalp, the distance may vary from 6 to 7 millimeters. Therefore, it can cause much more swelling because more vessels are disrupted, in contrast to what is the situation in a regular hair transplant. An artificial hair implantation has to be regularly maintained every 2 to 3 months because there is sebum formation around the core in which the hair implant lies. This sebum formation causes sebum plugs, which can cause intense itching. But if you itch, the hair will fall off. So itching, even if you have a very strong urge after a hair implantation process, is a big no-no because the implants can come out if you itch. So to summarize the stated benefits of a hair implant, number 1, it is sold as an instant hair restoration procedure. You are told that if you got a wedding coming and you have missed the timeline of growth of a hair transplant, you can go in for hair implant. Within very few days, you can go out, you can get married. Or if you have a special event, a special social occasion or function, the hair implant process is custom made for you. So it is intensely marketed as an alternative to a regular hair transplant, which it is not. They also state that there is no shedding process, so you do not have to take much care or wait for too long or take anti-DHT blockers. You can comb, wash and care for your implants soon after the hair implant process. And many people fall prey to the fact that your hair which is implanted, as age advances, they do not realize that the implant doesn't stay for more than 2 years. As age advances, they feel that the graying process of hair, which is a natural aging process, will not hit them. So it's all marketing, which creates illusion and a false sense of hope in the minds of people who are targeted. There is no harm in promotion if the correct facts, the correct details of the process are made known to the patient. And if then the patient goes in for a hair implant process, that's up to him, that's his decision completely. But if the patient has been forced or deliberately misguided, misled into thinking that a hair implant process is an alternative to a regular hair transplant. It has the same benefits and the same life as a regular hair transplant, that has legal issues. And such advertisements and such coercion, such persuasion can be labeled as fraud. So the causes of concern while using hair implants, number one, is that it is a foreign body. Howsoever biocompatible it might be, the body will strive to reject it. It's just a matter of time before the body causes inflammation and forms a capsule around the foreign body and expels the foreign body. So after a hair implantation process, it has been seen that 30% of the implants will fall off in the first year. So by the time you reach 3 years, 100% of the implants have fallen off. So you have to get more procedures. So more procedures mean more scarring, more decrease in the blood supply of the scalp, more cyst formation, more cicatricial alopecia, and more chances of carcinogenicity. And as you do more and more procedures, the blood supply to the existing hair gets cut off and the existing hair also fall off. So if you are so scared about the shock loss of a regular hair transplant, this is much more immense. This is much more immense in the gravity of the whole thing. Secondly, the implant, when it is exposed to the elements, to sun, rain, humidity, and so many other elements of nature, it can become dull as early as 3 months after the process. The fibers can give you intense itching because there is a sub-minimal amount of inflammation which is going on all the time till the body rejects in 3 years' time. So this inflammation in some cases might be so much that you feel like scratching. There is an uncontrollable desire to itch, but you cannot, because if you itch, the implants are going to fall off. So you're always cautioned against that. And sometimes when it becomes very itchy, you have to be on antihistaminics for a long time. So these are the 5 concerns. Number 1, the foreign body rejection. Number 2, the implant losing its texture and look in 3 months. Number 3, increased scarring, making your native hair fall off. Number 4, in spite of intense itching, you cannot itch. You have to resist the desire to itch. And number 5, and a great cause of concern, is the element of carcinogenicity which you are predisposed to after a hair implantation process. It might not happen in one hair implantation process, but when you continue to put more and more implants over the years, the body may respond by cancer formation. I am not a votary for hair implants. I am a strong, die-hard surgical hair restoration expert, and 100% of my work and my complete life is dedicated to surgical hair restoration using the most advanced FUE hair transplant technique. However, I do not rule out the use of hair fibers or hair implants in future, because as science progresses, as material becomes more biocompatible, who knows, one day this might be a success story. But till such time the company shows me 10 cases who have had a hair implant process 2 years back and are still happy, I will not make the change. Thank you for watching again. And if you have any questions, please write them in the comment box or send us a WhatsApp at 0091 981 453 1111 or my email address, which is mentioned on the upper right hand corner of my website, darlingbuds.com. See you in my next video. Take care.